Okay, myocardial ischemia, chapter 27, Goodman and Gilman. Has anybody cracked open Goodman and Gilman yet? I'll look down, I won't see the response. Okay, so myocardial ischemia, the myocardium is the stuff in red and it's heart muscle, right? So when we're talking about myocardial ischemia, we're talking about reduced impaired blood flow to the heart muscle. And of course, that causes, if you have that, then the pain that you get is called angina, right? Anybody watch the Saturday Night Live thing, the very first John Belushi skit? You should watch that. Okay, so in terms of myocardial ischemia overview, so symptoms for myocardial ischemia, which are chest pain and discomfort, are similar in most people. You guys probably know this stuff. So apparently what happens is there's this heavy pressing pain, substernal pain, that often radiates to the left arm, or the jaw, or the epigastrium. So people can be having angina type symptoms, but maybe they don't really think it because it's their arm, their pain is radiating. Okay, some folks though don't always have these typical symptoms, including, it's kind of a silly slide actually, women, that's like over half the population. So I plead guilty, yeah. So women, diabetics, and the elderly. So 2/3 of the population don't have these normal male symptoms. I'll probably pull that out of Goodman and Gilman, I'm sure. So, but they'll report discomfort in other locations, and also describe it a little differently, right? So of course, women have better verbal skills than men and can describe what pain they're having in better terms. I'm probably gonna get in trouble for saying that. Okay. Also, in most patients, angina is going to occur with exertion, and it's going to be relieved by rest or nitroglycerin administration. And what causes myocardial ischemia is an imbalance in the myocardium's oxygen supply versus its demand relationship. So you can have one of two things going on, or you can have both of these going on, really, which is when you get this big increase in myocardial oxygen demand, but the blood getting there isn't delivering as much oxygen as needed, then you can have issues, and so oxygen demand, of course, is going to go up with exertion. Okay, and then you can get a decrease in myocardial oxygen supply that can go on as well. And that's due to a decreased blood flow or decreased ability to carry oxygen. Right, so decreased blood flow, so stuff in the veins, it's occluding blood flow, that sort of thing. Okay, and that's pretty simple, and we're just going to start going on to angina treatment. And of course, this is my little Buddha in the backyard. This is not recently because my little Buddha in the backyard, it snows probably about here, right over his head, at least. But he undoubtedly still has his little piece of bamboo. And the last few years, he's carried around his little shell as well. Anyways, I told he was going to come back, so I'm fulfilling my promise, right? Okay, in terms of angina treatment, we've already been over beta blockers here, but you guys should be, I think, fairly straightforward, probably more straightforward than maybe some of the diuretic drugs in here. So the agents that get used include nitrovasodilators. So you guys know the transmitter agent that's going to work through nitrovasodilators.
Nitric oxide.
Nitric oxide, right? And of course, you're going to need to remember this. Nitric oxide works by stimulating cyclic GMP second messenger signaling, which is going to decrease contraction of smooth muscle, among other things. Beta blockers get used as well, right? Beta blockers, beta-1 receptor around the heart. Okay, couples to GS, so we'll need to continue to know that. Calcium channel blockers get used as well, so one of the other things, you're going to reduce the amount of calcium that's going into smooth muscle, reducing contraction that way. And then I'm not going to discuss too much, but antiplatelet agents like aspirin, so if you can stop coagulation. And then statins can get used as well. Block the production of lipids. Okay. In terms of angina treatment, these anti-anginal agents typically are just going to provide prophylactic or symptomatic relief. You know, something like statins, you might be starting to get at the problem a little bit, but you know, a lot of times it's just getting relief. The main goal of therapy is going to be to improve the balance of the oxygen supply to the heart versus how much the heart needs to keep functioning. And so to do that, you either increase the oxygen supply by dilating the coronary vasculature, so improving blood flow to the heart, or you decrease demand by reducing how hard the heart is working. And I think I'll go ahead and stop there, and we can continue on Friday, assuming, well, there's going to be class Friday, right?
Yeah.
I heard there's another snowstorm maybe.
Today.
All right.